Gentlemen, let me ask you something straight. You go to the gym, work on your arms, maybe your chest, perhaps even drag yourself through leg day, but have you ever once considered that your penis needs training too? Now I know what you're thinking. Dr. Caldwell, have you gone completely mad? But hear me out. Just like every other muscle and tissue in your body, the structures inside your penis need regular conditioning to stay healthy, elastic, and capable of producing reliable erections well into your later years. If that sounds surprising or even a bit daft, stick with me, because I've spent over 3 decades as a urologist, and what I'm about to share with you is backed by solid science, not some dodgy internet nonsense. By the end of this video, you'll understand exactly why this works and how to safely put it into practice. Before we dive in properly, do me a quick favor. Hit that like button so more men can discover this information. It helps the algorithm show this to blokes who actually need it. And drop a comment below telling me where you're watching from. I absolutely love seeing our community of men from all corners of the UK and beyond. And if you haven't already, subscribe for more straightforward science-based advice that keeps you strong and confident regardless of your age. Right then, let's get into it. There's a myth floating about that erections are purely about desire and what happens in the bedroom. But here's the truth, and I cannot stress this enough. Erections are fundamentally about vascular health and muscle health. Inside your penis, there are 2 spongy chambers called the corpora cavernosa. Now, these aren't just empty spaces sitting there doing nothing. They're comprised of specialized smooth muscle fibers and an intricate network of blood vessels. When you become aroused, your brain signals the release of nitric oxide, which relaxes those smooth muscles. Blood rushes in through the arteries, and the veins at the base of the penis are compressed, effectively trapping that blood so the erection remains firm and functional. Now here's where it gets interesting, and frankly, where most men get it wrong. Just like any other muscle group in your body, if these erectile tissues aren't used and properly oxygenated on a regular basis, they begin to stiffen, lose their natural elasticity, and can even develop scar-like tissue called fibrosis. That makes erections progressively weaker, less reliable, and in some cases impossible to achieve without medical intervention. So the real truth that nobody seems to talk about is this. Erections aren't solely about testosterone levels or how attracted you are to your partner. They're also about keeping the erectile tissue itself in proper working order, properly conditioned, if you will. And that's precisely where this concept of the penis gym comes in. For those of you who haven't come across my work before, I'm Dr. Sophie Caldwell, a urologist with over 30 years of clinical experience right here in the UK. I've worked with men in their 20s, men in their 80s, and absolutely everyone in between. I've seen it all, quite literally, and I can tell you with complete confidence that erectile dysfunction is not simply an inevitable consequence of getting older. It's about circulation, hormone balance, lifestyle factors, and yes, tissue fitness. Think of it this way. If you broke your arm and it was in a cast for 6 weeks, the muscles would atrophy, wouldn't they? They'd shrink. The same principle applies here. If you stop using your penis regularly, whether that's due to stress, illness, reduced sexual activity, or simply life getting in the way, the tissues inside can also decondition. That's precisely why men who maintain regular sexual activity or who deliberately exercise their erections tend to maintain significantly better function well into their later years. Now, you're probably sat there wondering, all right, Dr. Caldwell, what's the actual workout then? How do I exercise my penis safely without making a complete fool of myself? That's exactly what we're going to cover. I'm going to break this down into the 4 most common mistakes I see men making with their erectile health, and more importantly, how to correct each one properly. Mistake number 1, relying solely on spontaneous erections. Most men reckon that if they're still getting morning wood, everything's perfectly fine and they needn't worry. But here's the problem with that assumption. Nocturnal erections naturally decline with age, stress, poor sleep quality, or underlying health conditions like diabetes or high blood pressure. Biologically speaking, those nighttime erections serve a crucial purpose. They're your body's natural way of aerating the erectile tissue, bringing in oxygen-rich blood, and keeping those muscle fibers pliable and healthy. Without them occurring regularly, fibrosis gradually creeps in, and before you know it, you're facing difficulties you never anticipated. The practical fix for this is straightforward, but requires a bit of intentionality. You cannot simply rely on nature to do all the heavy lifting for you anymore, especially as you get older. This is where a vacuum erection device, sometimes called a penis pump, becomes genuinely useful. Now, before you roll your eyes and think this is some sort of gimmick advertised in the back of a dodgy magazine, let me be clear. When used properly and consistently, these devices draw fresh, oxygenated blood into the penis, giving those tissues the conditioning workout they genuinely need. This isn't about vanity or trying to impress anyone. It's about maintaining tissue health and function. Mistake number 2. Thinking that more pressure equals better results. This is where a tremendous number of men go completely wrong, and I see the consequences in my clinic regularly. They assume that pumping harder or for longer periods will produce better results or somehow make their penis larger permanently. That's simply not how this works, and it's potentially dangerous. Biologically, the objective isn't to stretch the tissue like you're inflating a balloon. The goal is to gently engorge the tissue, oxygenate it thoroughly, and train the veins and muscles to hold blood efficiently and effectively. Applying too much pressure can damage the delicate blood vessels, leading to bruising, discomfort, and even the formation of scar tissue, which is precisely what we're trying to avoid. The practical fix here is all about technique. Think of it like doing proper repetitions at the gym rather than just throwing weights around recklessly. Pump slowly and gently until you achieve a full, comfortable erection. Hold that for approximately 30 to 60 seconds. Then release the pressure and rest briefly. Repeat this cycle for about 10 minutes total. That's your complete set. Nothing extreme, nothing painful, nothing that makes you wince. Just consistent, gentle training that actually works. Mistake number 3. Completely ignoring the lifestyle component. Let's be brutally honest here. You absolutely cannot outpump a terrible lifestyle. If you're smoking, drinking heavily, dealing with untreated sleep apnea, carrying excess belly fat, or managing poorly controlled high blood pressure, none of the exercises in the world will fully compensate for that. Biologically, if your arteries are clogged or constricted, your penis is often the first place where it becomes apparent. Why? Because the penile arteries are remarkably narrow, only about the width of a piece of spaghetti, far smaller than your coronary arteries. If blood isn't flowing efficiently through those tiny vessels, it's a significant red flag for your heart and brain health as well. Erectile dysfunction is frequently an early warning sign of more serious cardiovascular issues. The practical fix involves making some lifestyle changes that you've probably been putting off. Walk for at least 30 minutes most days of the week. It doesn't need to be Olympic speed. Just a proper walk where you're moving consistently. Do some form of strength training twice a week. You don't need to become a bodybuilder, but maintaining muscle mass is crucial for testosterone production and overall metabolic health. Cut back significantly on alcohol consumption. The occasional pint is fine, but regular heavy drinking absolutely destroys erectile function. If you're still smoking, for heaven's sake, quit. I know it's difficult, but smoking is one of the single worst things for vascular health. And finally, sleep like it actually matters, because it genuinely does. Your body repairs itself, produces testosterone, and regulates numerous critical hormones during quality sleep. Mistake number 4. Obsessing purely about size. This one is largely emotional and psychological, but it's incredibly common. Many men pick up a pump device thinking it's some sort of shortcut to adding permanent inches. And when that doesn't magically happen, they become discouraged and give up entirely. Here's the unvarnished truth that I tell every patient. The genuine, durable benefit isn't about permanent size increase. It's about function, reliability, and confidence. It's about achieving firmer, more dependable erections. It's about having confidence during intimacy rather than anxiety and fear. It's about maintaining your dignity, independence, and freedom to enjoy your sex life without constant worry. The practical fix here is fundamentally about shifting your entire mindset and expectations. This isn't about constructing a bigger penis to show off in the changing room. It's about building a healthier penis that continues to function properly for decades to come. It's about quality of life, maintaining intimate relationships, and preserving something that contributes significantly to your overall well-being and happiness. Right, so here's the straightforward weekly routine that I recommend to many of my patients, and I've seen it work remarkably well when followed consistently. 3 to 5 days per week, dedicate just 10 minutes to a vacuum device interval session. Remember, pump gently and slowly. Hold for 30 to 60 seconds. Release and rest briefly. Repeat this cycle. During those rest periods between pumping intervals, practice gentle pelvic floor exercises. These are sometimes called Kegel exercises, though they're not just for women. Contract those pelvic floor muscles for 3 seconds, then relax for 3 seconds. Do 5 repetitions during each rest period. This strengthens the foundational muscles at the base that actively support erections. Every single day, make sure you're moving regularly. If you sit at a desk all day, get up and walk around every hour. Blood flow is absolutely critical, and prolonged sitting is terrible for circulation. Twice a week, incorporate some proper strength training. Focus on the fundamental movement patterns. Push, pull, squat, and hinge. Building and maintaining muscle mass is essential for protecting testosterone levels as you age. Aim for 7 to 8 hours of quality sleep each night. That's when your natural testosterone production and nocturnal erections work their magic and help maintain tissue health. Additionally, and this is optional depending on your doctor's approval, you might consider pairing your routine with a natural nitric oxide booster, such as L-citrulline, which is derived from watermelon extract. It helps improve blood flow throughout your body and can make these exercises even more effective. Always discuss supplements with your GP or urologist first, particularly if you're on any medications. Now, I want to pause here for a moment, because if you're a man watching this and thinking, Dr. Caldwell, I feel like my best days are well behind me, I'm too old for this to make any real difference, I want you to listen to me very carefully. That is absolutely not true, and I see evidence to the contrary every single week in my clinic. Erectile function is not exclusively about youth or being in your 20s. It's fundamentally about habits, consistency, and taking proper care of yourself. I've worked with men in their 70s and 80s who still enjoy deeply satisfying, confident, intimate relationships. Why? Because they maintained healthy circulation, kept their hormones reasonably balanced through lifestyle choices, and yes, they exercised their erections regularly, even if they didn't specifically call it that. This isn't about performing like you're in some ridiculous adult film. It's about being the best version of yourself at whatever age you happen to be. It's about feeling genuinely comfortable and confident in your own body. It's about enjoying intimacy with your partner without the constant anxiety that comes with unreliable performance. That sense of confidence and freedom is absolutely priceless, and it's available to you regardless of your age if you're willing to put in consistent effort. I also want to address something that I know many older men struggle with, but rarely discuss openly. There's often a profound sense of loss and grief when erectile function begins to decline. It's not just about sex, although that's certainly important. It's about feeling masculine, capable, and vital. It's about maintaining an intimate connection with your partner that's been part of your relationship for decades. It's about not feeling like you're letting anyone down, including yourself. These feelings are completely valid and understandable. But here's what I want you to know. Taking action, even small, consistent action, can make an enormous psychological difference. It gives you back a sense of control and agency over your own body. That alone is incredibly powerful. I've had patients tell me that simply having a routine, having something concrete they were actively doing to address the issue, reduced their anxiety enormously, even before they saw significant physical improvements. The mental and emotional benefits of taking charge of your health are just as important as the physical benefits. You're not helpless, and you're certainly not too old to make meaningful improvements. One more thing I want to mention, because it comes up frequently in conversations with patients. Many men worry about discussing these issues with their partners. They feel embarrassed or ashamed, and they try to hide what's happening, which only increases stress and anxiety. Let me be absolutely clear. If you're in a relationship, having an open, honest conversation with your partner about what you're experiencing and what you're doing to address it can strengthen your relationship rather than damage it. Most partners are far more understanding and supportive than you might expect. They'd rather know what's going on and be part of the solution than be left in the dark, wondering what's wrong. Sexual health is an important component of overall health and relationship well-being. Treating it like some shameful secret only makes everything worse. You deserve support, understanding, and partnership in addressing this, just like you would with any other health concern. There's absolutely no shame in acknowledging that your body is changing as you age, and that you're taking active steps to maintain your health and vitality. So, here's your main takeaway from everything we've discussed today. Use it or lose it. That old saying genuinely applies here. Treat your penis like the valuable tissue and muscle structure it is. Train it gently, consistently, and intelligently. Combine that physical exercise with lifestyle habits that actively support healthy blood flow and hormone balance. Prioritize movement, strength training, quality sleep, and managing stress. And remember, and I truly mean this, it is never too late to start making positive changes. If this video has been helpful to you, I'd appreciate it if you'd do 2 quick things for me. First, hit that like button so that more men can find this information. The algorithm needs engagement to show this content to people who genuinely need it. Second, drop a comment below, telling me one specific healthy habit you're committing to this week. It doesn't need to be enormous or dramatic. Even small changes compound over time. And if you haven't already done so, please subscribe for more straightforward, science-based men's health advice. No shame, no judgment, no ridiculous pseudoscience. Just real, practical answers that you can actually use to improve your life. Gentlemen, getting older does not mean the end of vitality, virility, or enjoying a satisfying, intimate life. With small, intentional, consistent steps, you can protect your erectile function, maintain your confidence, and preserve your freedom and quality of life for many years to come. You absolutely deserve that. Every single one of you deserves to feel capable, confident, and comfortable in your own body at every age. I'm Dr. Sophie Caldwell, and I'm reminding you to take proper care of your health, because you are genuinely worth the effort.